Happy Tuesday. Good evening, everyone. I'm Dr. Joaquin Acosta, your guide and advocate in the ever-evolving world of pharmacy and healthcare. Welcome to tonight's Know Your Pharmacist Livestream, where we're not just sharing information, we're shaping the future of healthcare together. As the CEO of Pharmtrue, I'm here to bring you the latest insights with a blend of expertise and empathy. Tonight, we dive deep into the heart of pharmacy, exploring how recent policies and technological advancements are revolutionizing patient care and pharmacy practice. In our Pharmacist Frontline segment, we're going to dissect the Lower Costs, More Transparency Act, this critical legislation that could redefine healthcare delivery, and we're here to analyze its impact on both sides for patients, providers, healthcare systems. It's about transparency, fairness, and the future of healthcare. Next, in Tech Talk, we address a pressing concern, the privacy of medical data. With pharmacies sharing information without warrants, what does this mean for our rights and confidentiality? Well, we're here to unravel the complexities and advocate for your privacy. Moving to our Enlightenment Hour, we focus on the patient engagement in the digital age, how healthcare organizations are optimizing patient experiences through technology. It's about connecting, understanding, and empowering each patient in their healthcare journey. In our Herbal Wellness Corner tonight, we're going to be spicing things up with a look at homemade holiday edibles. Join us as we explore creative and therapeutic uses of cannabis in the culinary world. In our Community Spotlight, shine on the Roasted Rooster Coffee and Waffles grand opening this Friday, supporting Casa de Peregrinos. It's about community, compassion, and coming together for a course that touches us all. And finally, in our Men's Health Minute, we take a visionary approach to men's health and wellness. Time to redefine men's healthcare, focusing on holistic, personalized care, and we will give you guys an awesome resource. Thanks for joining us tonight. Your engagement and support make this journey towards better health and understanding possible. Awesome, guys. So let's learn, grow, and transform together and get this thing started. Starting first things first in our Pharmacist Frontline segment, talking about the Lower Costs, More Transparency Act. Bill 5378, a bill that aims to increase price transparency in the healthcare system. A dying need we've been looking for a while. The bill would require hospitals, payers, labs, imaging providers, and ASCs to publicly list the prices they charge patients. Hospitals also would be required to publish all standard charges for at least 300 shoppable items and services. In the pharmacy world, this bill does address the cost of prescription drugs. It ensures that senior citizens on Medicare never pay more for a drug because of where it's administered, whether it's the hospital, so on and so forth, at home. Support patients, healthcare workers, community health centers, and hospitals are all benefactors of this, guys. But the one thing here, the American Medical Association actually chimed in on, is that these site neutral payments that are in this bill, it's about a $16 billion cut for hospitals over 2 years, and that's scary, right? The thing that we like about it from the pharmacy side, of course, and the healthcare side, right? The Lower Cost, More Transparency Act curbs the PBM, the Pharmacy Benefit Manager spread pricing, right? So this spread pricing model is really what creates the randomness and the obscurity where they are able to just suck money out of the states. And again, some of the objectives, I think, here for the state of New Mexico, they're looking at around $10 million plus that would, not be sucked out. And they have data as per state as to what would be, who would be benefactoring and how much over how many years through this money. But again, it's frustrating here because the American Medical Association and the American Hospital Association that are advocating on the hospital side, that part being written into the bill is going to have to, make it through the Senate, which might be the reason it could get even turned down. So we don't even know if, right now. HR 5378 is going to get fully approved yet, but at least seeing to the acknowledgement and getting there, we're getting to a point that hopefully we can fight back on the PBM. So let's jump into the next segment in Tech Talk, guys. Pharmacy sharing medical data without police warrant. So this was a big one that just came up today. Interestingly enough, did you guys know that, there's an investigation right now on big box pharmacies that literally, again, pharmacies are giving, police officers pharmacy and prescription data without any warrants. And that's, again, creepy. So again, although pharmacies are legally permitted to tell their customers about government demands for their data, most don't, being found, right? As a result, many Americans' prescription records have few meaningful privacy protections, and those protections vary widely depending on which pharmacy they use. So they found, through briefings with major pharmacies, each year law enforcement agencies secretly obtain prescription records of thousands of Americans without warrant. In many cases, pharmacies are handing over sensitive medical records without review by a legal professional. So again, what they're saying here is, yes, these big pharmacy chains, CVS, Walgreens, cough, truly were, facing some of these staffing situations that might have, led to distracting situations where pharmacy employees are not asking and making sure that, warrants are out there, so on and so forth. And, CVS cited their policy for HIPAA to cover it, although Amazon was the only one pharmacy with a policy that actually notified their patients every time, their information was requested. So very, very interesting here. Not anything that can be corrected like today or tomorrow, but just something to be aware of, again, for sure. And if that may affect you in a different way, think about that too, for sure. All right, let's move on. So our Enlightenment Hour, guys, talking about how healthcare is optimizing patient engagement. I was going to tie into our men's health here, but the good example for this today, again, Cutler Center for Men's. It's a Cleveland-based hospital, and it's really changing the output of healthcare for men's health. And you're looking at how exactly that they're attacking this. Well, they're looking at the fact that literally, obviously, we know men's health has big gaps in care, that men are not making it to the doctors, and they've created a platform, through their Cutler Center for men, for not only on site but online, and another resource here called Just Ask Joe, which is a dedicated care provider to men, for men's health and all this stuff. So, guys that are looking for that digital access to healthcare, again, this one is huge, and this is where we're talking about this today. And as you look at niche services in the healthcare world that are tackling healthcare, engagement is what we're looking at, and patient engagement, hard to keep people engaged if you are looking at the barriers to healthcare access. But where they're seeing is that people want the healthcare access. It's just well, how do you actually give it to them, right? And again, I think this, in terms of personalized niche care, is where it's going, especially in the online world. This where primary care providers are again, going to look at you holistically, follow your medical plan, and work you as long as they're going to have you, and keep record of it, and then pretty much send you to whatever other professionals that you're going to need to be, so those referrals and all that take you to other specialists, where that can lead to even more healthcare access barriers, because switching from one doctor to another, this one is super cool, because you could be one type of patient seeking one type of care that maybe, if you're a man, woman, so on and so forth, cancer, diabetes, these kinds of things that we're trying to look at in our society, where these apps can really help to dial in on that, and then actually have healthcare providers in there that are working people up, giving them different insights. So cool stuff. I hope for everybody out there. We'll talk a little bit about that here in our Men's Health Minute, dive deep into it. But first things first, guys, I want to share a couple recipes tomorrow on our High Horse Cannabis Full Spectrum podcast. We're going on live about noontime. We're going to be making some cannabis Cheetos using, I believe, full spectrum oil, but we're going to give you guys demos on how to decarb flour and, make canna butter to put in here. So, I challenge you guys in our Herbal Wellness Corner today, brought to you by High Horse Cannabis Company, to make some cannabis edibles for holidays. Have yourself a little bit of a therapeutic time. As much as maybe somebody might be binging wine, try some fudge, some other things here. Snowball cookies, obviously, guys, Biscochitos are our thing. Infused hot cocoa, I like the idea of it. Infused candies, pecans, that's a pretty local looking treat there. Give you guys the recipe list. Holiday edibles recipes. This one I like the items that they offered here. But again, you can put canna butter, canna sugar, FSO into just about anything. You just have to have it attached to some sort of a fat and make sure it is, but it's very cookable. So it's just kind of our Herbal Wellness Corner reminder today. If you haven't cooked with cannabis before, you should really try it. Getting down to dosing it, so on and so forth, becomes, right, the lesson that you should take out of that, because a lot of people who cook their own cannabis edibles at home can easily overdose, right? I mean, not overdose and die, but, hit past your ceiling dose, not have therapeutic effects, hit way too much, psychoactive effects, so on and so forth. So again, actually having to calculate milligrams per serving, so on and so forth, and dialing that in, that does take some pretty good math there, guys. So, I'm sharing you guys the calculations here, and hope you guys have good luck going out there and doing that math. If you need help dosing, cannabis, when you send me a message, I will try to get back to you and help you on a recipe or whatever. But good luck. Hope you guys enjoy some delicious food. All right, cool. So let's move on to our community spotlight today, guys. Shining the light on the Roasted Rooster Coffee and Waffles grand opening. They're collecting canned goods to support our local shelter, the Casa de Peregrinos. I believe that's Friday from 3 p.m. to 7 p.m. Their grand opening, delicious local cuisine, coffee and waffles, great vibes, great atmosphere, great food, great service, everything you could ever want. Sweet. So hope you guys go check it out Friday. Go bring some canned foods and enjoy. So in our Men's Health Minute, guys, for all our dudes, guys, wives, moms, sisters, all that out there, friends, sharing with you guys and girls in the just a link to the UH Hospital's Cutler Center. It's, if somebody's looking for personalized online bit of care, this place for their members is pretty cool. Talking about their Just Ask Joe program, the Joe team, right? They've literally got men's health guides, so your own personalized, Joe that will call you, follow up, suggest your maintenance, so on and so forth. So it's kind of cool. You get to treat yourself in a way, kind of like a car, right? You're getting the workup. You're going to be following all these, the right path there, and somebody's going to guide you through it. And again, you don't want to take shortcuts on your own bodies, men out there. You got to get the test and tune. You got to know what's going on. Get the labs. Follow the schedules. Get them at whatever times in your life that you need to, so on and so forth. Right, and that's how it goes. So other than that, I hope it's a nice, quick one, fun one tonight. And you guys learned a little bit. I sure learn a lot every single day. And,